it's me, Carly Burridge, founder and owner of GainingHealth.com, and we're back for another episode of What's Up Wednesday, where we discuss recent journal articles from the research journal Obesity and talk about how we can apply this information to our practice. Before we get to that, I want to review real quickly. If you have not gotten your copy yet of Developing Your Obesity Management Program, the Healthcare Provider's Roadmap, make sure you get your copy on GainingHealth.com. And also this week, I just added 14 different forms, letters, templates, anything you could need to start your own obesity medicine practice, or perhaps you have a practice already, but you're missing some of those forms. So look on GainingHealth.com also to get those forms. All right, so now let's get to the journal article for this week. We are talking about an article with the title of Pharmacogenomics of Medication-Induced Weight Gain and Anti-Obesity Medications. The primary author is Singh et al., and it was published in the February 2021 edition of Obesity, a research journal. So first of all, before we jump into it, what is pharmacogenomics? So pharmacogenomics is the study of the effects of genetic variation on the response of a drug or a medication. And so this article was a review article that looked at the genetic factors to determine how these factors affect the weight gain properties of certain pharmaceutical agents that are known to cause weight gain. So we'll talk about what some of those are. And then they also looked at how genetic factors influence the efficacy of anti-obesity medications on weight loss. So this is really interesting information, and certainly this can be used in the future to predict the likelihood of weight gain with certain agents or the weight reduction with some of the anti-obesity medications, so that we can really offer personalized care to our patients. Precision medicine is something that is gaining a lot of interest these days. So first I want to review real quick. They gave a great overview over a lot of the medications that are weight promoting. So this is something that we can all use right now and we should be using in our practice. So they looked at antipsychotics, antidepressants, anti-epileptic drugs, glucocorticoids, hyperglycemic agents, and beta blockers. And they kind of looked at those, and they also went over which ones are more likely to cause weight gain. So we know that for the antipsychotics, there are certain medications that can cause substantial weight gain, including clozapine and olanzapine. Some of the medications that can cause a moderate amount of weight gain include risperidone and sertinidol. And then ones that only result in a slight increase in weight are aripiprazole and a few of the other ones, iloperidone and amisulpride. And then ones that had negligible or only slight weight gain included ziprasidone and quetiapine. So, keep that in mind for anybody who's prescribing antipsychotic medications, or if you're seeing a patient who is on antipsychotics, you can always consult with the psychiatrist or whoever is prescribing these medications to see if maybe they could be switched to a different medication that might not be as weight promoting. When it comes to antidepressants, we know that paroxetine is most likely to cause weight gain, and that bupropion is least likely to cause weight gain. So again, we want to keep that in mind as well. With the anti-epileptic drugs, especially valproic acid, we know that can result in significant weight gain, and carbamazepine and lamotrigine caused non-significant weight gain, and they considered significant weight gain greater than a 7% weight gain. And of course, we know that topiramate can help with weight reduction. Of the glucocorticoids, they really didn't talk about specific glucocorticoids. They didn't distinguish between prednisone and dexamethasone. For instance, in the readings that I've done in the past, prednisone does appear to be more weight promoting than dexamethasone, but again, they did not talk about it in this study. And they did say that short-term use of glucocorticoids did not significantly affect weight, appetite, energy intake, or body composition, but that long-term use is associated with increases in all of these parameters. And in general, they don't have a lot of information about the pharmacogenomics of the corticosteroids with weight gain. Of the anti-hyperglycemic agents, they mentioned that sulfonylureas and TZDs are most commonly associated with weight gain, which we do know. They didn't mention insulin, so I don't know if they were just looking at oral medications, because obviously we know that insulin is very weight promoting. But again, maybe they were only looking at orals. And they also did not mention the weight reduction effects of medications like metformin, GLP-1s, or SGLT2 inhibitors, but we know that those can actually help with weight reduction. So we need to be using those medications as much as possible. Beta blockers, they just mentioned that they cause weight gain. They didn't say specifically which ones. Again, metoprolol tends to be the one that causes the most weight gain compared to, for instance, carvedilol, but all of them cause weight gain. And again, they didn't specify in this article, between metoprolol or carvedilol. And then they did the same thing. They looked at the pharmacogenetics of the anti-obesity medication. So they looked at liraglutide, topiramate, orlistat, bupropion, sibutramine, which is of course no longer on the market, and metformin. And they did see an impact of certain alleles on weight loss outcomes. So again, this can be very helpful in the future as we're individualizing care of pharmacotherapy and really creating that precision medicine down the line. So in conclusion, a lot of this information about genetics we're not really able to use clinically just yet. We're starting to get there, but I think this is something that we need a lot more research on for the future. It can certainly be very helpful in the future. And currently, in the meantime, it's just important that we all become educated on which medications can promote weight gain, and that we try to use medications that promote less weight gain or that can even help with weight reduction, especially obviously in our patients who struggle with excess body weight already. So that is it for our review article for today. Again, if you haven't gotten a copy of the Obesity Medicine, Developing Your Obesity Management Program Roadmap, make sure you go to gaininghealth.com to get that. Also take a look at those forms, see if you're in need of any of those. And if you subscribe at gaininghealth.com, I will send you emails when we have new products and resources that are available. So thank you all so much. And I look forward to seeing everybody next week for our next episode of What's Up Wednesdays. Take care. Bye.